Hi, good morning, good afternoon, and good evening, depending on when you are able to access this particular section. As I will be discussing with you something very important and vital in our healthcare practice as a practitioner, so student too, and that is the concept of vital signs assessments. So in this particular short section, we'll be looking at um, okay, so upon completion of this particular section, you should be able to define what procedures are, uh, how to take patient temperature accurately, how to take patient's pulse accurately, and how to take patient's respiration accurately. Then finally, how to take the blood pressures. So these are the expectations you should be able to meet at the end of this particular section. All right, so in this particular section, we'll be taking it to our introduction, when to assess vital signs, rationale for assessment of vital signs, temperature taking, oral, in terms of oral sites, rectal sites, ear sites, auxiliary sites. They will look at factors affecting body temperature, procedure for obtaining temperature, factors affecting pulse, factors affecting blood pressure, and all of that. We're going to look at that. We're going to look at all of this in this particular section. All right. So by way of introduction, by way of introduction, uh, temperature, pulse, respiration, and blood pressure are considered the vital signs in that they are very much important, because if there's changes or what we call deviations from the normal range, then patients might be at risk or maybe life-threatening. That is why if you walk into a hospital, these are basic things, basic assessments that must be done after taking your information. So what is vital signs? Vital signs may be referred to as the monitoring of the body's most basic function, most what? Basic function, or the measurement of the body's homeostatic mechanism. You know that temperature is being regulated by a particular feedback loop. The same way blood pressure, respiration, and all of that. So they are very basic, because if there is a challenge in any of this, the patient's outcome or the chances of losing our patient or the chance of person facing life-threatening situation is always what? High. So the reason we need to actually be careful about vital signs is that, one, they are crucial indicators. They're actually crucial indicators of a patient's overall health. It's important. If you understand that they are very much crucial in a patient's overall health, you will pay closer attention and learn how to actually estimate all of these vital signs. So vital signs provide us with fundamental data that can be used to monitor patients' physiological status. And also it will also help us in making clinical decisions. You assess a patient's blood pressure is very high. The top priority. It could be that the headache the patient is complaining. It's the blood pressure that is high. So you now prioritize in your decision to actually relieve that high blood pressure. And when you do it, headache will go. So it helps us in clinical decisions and also in diagnosing disease. Using the example I cited above, the problem the patient came with is blood pressure. So that is why we need to pay closer attention to it. So in a nutshell, the reasons why, or the reasons rather, is, or the why is, one, to monitor health status of the patient. So vital signs help us to have a baseline information about the patient, which will help us in future to compare. Let's say it was bad when they come. It's expected by the time they are going, the data should have been better. So they are basic, which will help us know if there are significant changes. The treatment you are giving, whether it's going or not. It also helps us to detect early medical challenges, especially identification of emergencies. For example, a rapid increase in heart rate or a drop in blood pressure can be a sign of acute medical emergencies, such as shock, sepsis, or even cardiac arrest, which should prompt immediate intervention. Also, it helps us also to do what's called prediction of value. But for example, there is a type of breathing pattern known as Kussmaul breathing. That kind of breathing pattern can make us to know or even help us in diagnosing a patient's condition. Like I said, it also helps us to guide, to have a good clinical decisions. It contributes to diagnostic tool and also in treatment evaluation. And also, vital signs are key aspect of nursing practice because it's what we use to evaluate the standard of care. When the vital sign is being monitored, it helps us to ensure that the patient is safe because from time to time, hourly, 2 hourly, you are monitoring the temperature. That will help us to know the patient, whether the patient is in the safer part or the patient is progressing or deteriorating, so that with that can be addressed quickly and as such, ensure the safety of the patient. In what is known as end-of-life care, vital signs play or contribute a role in what is known as palliative care. It helps us to determine the prognosis, that is the likely outcome of the patient. So that is why it is important to actually take vital signs. And it's also contribute in health education of the patient. When you take the patient's vital sign and find out actually deranged or abnormal, it can also help you in educating the patient and all of that. It also contributes in legal and regulatory standard. It's important you take the vital signs of the patient and record them, because this is important when there is issues of litigation to know whether you actually complied with the standard of practice in that particular country. So that is why you need to actually know more about vital signs. So let's also look at the vital signs, what it encompasses. So in a nutshell, it encompasses parameters that reflect the body's essential function, like we said earlier, such as temperature, respiratory rates, blood pressure. You understand? So now let's look at temperature, body temperature. Body temperature are also known as thermoregulation. The body maintains temperature through a process called thermoregulation, primarily controlled by the hypothalamus in the brain. The hypothalamus receives signals from temperature receptors. And when you talk about temperature receptors, they are a set of nerves and sensors that are found all over the body, especially in our skin, in the skin of human body. That's where these sensors are found. And their function is to sense the temperature of the body. As the blood flows through the blood vessels and all, it detects the temperature of the body and sends information back to the hypothalamus. And in the hypothalamus, this information is interpreted whether hotness or coldness. As such, the hypothalamus will adjust through a feedback loop. You've heard about negative feedback mechanism and positive feedback mechanism. So it's a hypothalamus that regulates this. And in the human body, heat production, that's what we call heat production and heat losses, because they are the two key things that determines the body temperature. How do the body generate heat? The body generates heat through what is known as metabolic process. That is process of breaking down food substances, or the process of forming, because when we talk about metabolism, it's of two: catabolism and anabolism, breaking down and building. So now, during that metabolic processes, primarily carried out by the liver. You've heard about the liver does detoxification, formation of new substance, and all of that. So the liver and the muscles primarily are involved in this metabolic process. And the muscles does this mostly during exercise. So through that process, heat is being produced in the body. Then how do the body lose heat? The body loses heat through what is called radiation, conduction, and convection. I believe in your secondary school, they introduced the concept about heat conduction from one surface to the another, radiation to the air around, and convection and evaporation. So these are the processes that heat is being lost from the body. So the mechanism that keeps this heat production and heat loss in check is in the body and being controlled by the hypothalamus. So when one exceeds the other, the body tends to have issues with thermoregulation. And these heat losses through conduction, convection, and evaporation, as the blood flows through the blood vessels. Through sweating, heat is lost, and all of that. So when the fever comes, fever is actually when thermoregulation has failed for some reasons, so that's disease conditions and pathologies, such as in malaria and all of that. So fever mechanism is just an elevated body temperature, often resulting from infection or inflammation, and which is being controlled by what is called endogenous pyogens. So when these endogenous pyogens are secreted in the blood from parasites and all of that, from infection and all of that, or from inflammatory processes, these pyogens send signal to the hypothalamus, and the hypothalamus, like we said earlier, is the control center. It will now tune up. It will increase the heat production. It will not tune up heat production through metabolic processes. You already know how heat is being produced through metabolism and all of that. So when you not tune up the metabolic process, heat production will be increased. And as such, there will be fever. You understand? So as a result of that, pyogens coming from infection or inflammation will lead to the hypothalamus tuning up heat production. So that is how fever is being produced, or that's the concept behind fever in the body. We've been able to look at temperature as vital sign and how it occurs, and the mechanism holding it in check, and its regulatory center, the hypothalamus, and what can lead to fever, with a sign of infection or inflammation in the body. Then let's look at another vital signs known as pulse or heart rate. That's what is called cardiac output. Heart rate is influenced by cardiac output, and which is the volume of blood the heart pumps per minute from the heart. So the amount of, or the volume of blood that leaves the heart from each pumping is known as cardiac output. Cardiac output is one of the parameters behind heart rate. The amount of blood leaving the chambers of the heart per minute. So now, the heart rate is being influenced by both intrinsic factors. When we talk about intrinsic factors, we're trying to talk about factors within the heart, such as the firing of the sign arterial node. That's what's called the firing of the sign arterial node in the chambers of the heart, the ventricles of the heart. That's what's called the sign arterial node. So if the sign arterial node is overfiring, it will lead to increase in heart rate. So that's why we say it's an intrinsic factor within the heart. Then we also have what is called extrinsic factor, that is factors outside the heart, such as autonomic nervous system activity. You already know about autonomic nervous system. We'll talk about uh, peripheral nervous system, under which we have sympathetic and parasympathetic nervous system. So they are called extrinsic because they're not within the heart. So if the body is already tensed up, maybe due to fear, the person is facing danger, then it will influence the heart rate. The heart will pump more. So that's, we call it extrinsic factor. So the heart rate is influenced by both intrinsic factor and extrinsic factor. You understand? And that invariably impacts on the heart rate. So that's just the two factors that determine the heart rate. You understand? The intrinsic factor, we'll talk about the sign arterial node firing, and the extrinsic factors such as the parasympathetic activities and sympathetic nervous activities, such as flight or fight response through the release of certain chemicals in the blood known as catecholamines, like epinephrine or the adrenaline. When it's dropped, you see the heart beating very hard, faster. So that number of beats per minute is known as heart rate. And this tells us what is going on in the body. So that's why it's a vital sign. A lot of factors can influence the heart rate, such as physical fitness, someone that is running, the age of the person, hormonal changes, body temperature. Yeah, when the body is undergoing serious inflammatory response that leads to production of fever, the heart rate tends to increase. And when someone is actually exercising, the the heart rate tends to increase. The next we're going to look at is the mechanism behind respiratory rate. We are done with heart rates. The mechanisms or the mechanics of breathing involves the diaphragm, you already know, and the intercostal muscles, which contract to facilitate inhalation and also relax to allow exhalation. So the exchange of oxygen and carbon dioxide occurs between the alveoli of the lung and the blood. That is known as internal respiration. Whereas that of external respiration is between the removal of that carbon dioxide from the lungs to the outside world and the taking in of the oxygen in. So when the oxygen gets the lungs, the oxygen have to leave the lungs to enter the blood. Okay? So this process known as respiratory rate is being regulated by what is known as chemoreceptors. You know about the central nervous system in the brain and the peripheral nervous system. All of these, they have nerves, the cranial nervous system and the spinal nerves and all of that, and cranial nerves too. So that's what we call the chemoreceptors. These chemoreceptors monitor carbon dioxide and oxygen level in the blood. They are found in the blood vessels, especially in the what is called bifurcation of the carotid artery. The carotid artery that supply to the head region, that's a bifurcation where these chemoreceptors are found. So now these chemoreceptors monitor, as the blood is flowing through it, they monitor carbon dioxide level and oxygen levels in the blood. So when there is elevated carbon dioxide level, known as hypercapnia, it stimulates an increase in respiratory rates, while low oxygen levels, known as hypoxemia, also triggers an increase in breathing. Now, if the blood that is flowing through, you know that the body maintains the balance between carbon dioxide and oxygen so that you can be alive through a feedback mechanism. Now, if at all that your blood is having excessive carbon dioxide, known as hypercapnia, it means that the body will soon go into acidosis, because excessive carbon dioxide is not good in the body because the cells does not need it. So if there is excess carbon dioxide, there's greater likelihood of low oxygen level. I know that the body requires oxygen to continue its life process. As such, hypercapnia would trigger the heart rate to increase. The person will be breathing faster. And the same way, hypoxemia, low oxygen, will trigger the heart to be, the person will be breathing faster. That is why when you take assessment of respiratory, it's important. It could also be that the problem that's leading to that increase in heart rate, increase in respiratory rates that resulted from hypercapnia and hypoxemia is a problem that is occurring in the lungs. Maybe the lung is having pneumonia, or the lung is infected, or the lung is highly inflamed, or the lung is having a serious issue that is preventing the amount of oxygen getting to the blood. So that is why respiratory rate is important. As healthcare workers, we must monitor that vital sign very well. And also remember that the respiratory rate is under the control of the brainstem. Temperature is being regulated by the hypothalamus, whereas respiratory rate is under the neural control of medulla oblongata and the pons. I've taught you that in the other sections. So they regulate the depth and rate of breathing based on the information that are getting from the chemoreceptors as the blood flows through these veins. Also, recall that respiratory rate also can be influenced by factors such as emotional states. When somebody is having fear due to adrenaline or catecholamines being released in the blood, the person is anxious. The breathing rate is increased because of those hormones or chemicals that are being released in the blood. Also, certain drugs you take can also influence the respiratory rate in a patient. Also, by way of introduction, let's also look at blood pressure. Blood pressure has to do with cardiovascular dynamics. And like we said earlier, when we were talking about heart rate, which is determined by intrinsic and extrinsic factor, cardiovascular dynamics, such as the blood pressure, is being determined by cardiac output, that amount of blood or the volume of blood that leaves from the heart per beat of the heart. That's not cardiac output. And then the systemic vascular resistance. You know, the blood vessels, such as the arteries and veins, they offer a sort of a kind of resistance to the blood leaving from the heart. So both the cardiac output, that the volume of blood leaving the heart, and the resistance offered by the vessels determine what? Blood pressure. As such, cardiac output, which is the volume of blood that is leaving the heart, is also being influenced by heart rates. And you know that it is the chambers that pump this blood. So if an intrinsic issue is happening within the ventricles of the heart, that means the heart will not fire enough to push enough blood out. So that is why the cardiac output, volume of blood leaving the heart, is being influenced by heart rate and also the stroke volume. So to narrow it down more, the blood pressure, which is a function of cardiac output, blood, total volume of blood leaving the heart, and the resistance offered by the peripheral arteries and veins, is being regulated. That is, the blood pressure is being regulated by blood pressure. Blood pressure is being regulated by what is known as baroreceptors. So the blood pressure of a person is being monitored or being regulated by contribution from baroreceptors. And these baroreceptors are also located at the carotid arteries and aorta. These receptors senses or determines changes, or detects changes, it detects changes in the blood pressure and sends signals to the central nervous system to adjust heart rate and vessel diameter. Recall, I told you that blood pressure is a function of cardiac output, the volume of blood leaving the heart, and the peripheral resistance offered to that blood leaving from the heart. Now, cardiac output is a function of heart rate and stroke volume. And we've said that heart rate is being determined by intrinsic and extrinsic factor. The intrinsic factor has to do with the sinoatrial node, and the extrinsic factor has to do with autonomic nervous system, catecholamine influences. You understand? So now, the thing that senses the blood pressure in a person is baroreceptors. If this baroreceptor find that the blood pressure is high, they will not send information to the brain for adjustment of the heart rate, because we know that the heart rate is under the influence of both intrinsic factor and extrinsic factor, such as the sympathetic nervous system and the parasympathetic nervous system. So when they now send information to it, it can either lower it or increase it, depending. Then another thing is that the same peripheral nervous system have its sensors at the blood vessels. It would either increase the diameter of the blood pressure, the blood vessels, sorry, to allow more blood to enter, or it will decrease it, depending on what is being trying to be regulated. Another thing that contributes to regulation of blood pressure is the renin-angiotensin-aldosterone system, RAS. This has to do with a kind of hormonal system that regulates blood pressure by adjusting blood volume and the systemic vascular resistance. So when the blood pressure is high, in response to that high blood pressure or low blood pressure, as the blood is flowing through the kidney, the blood flows through all the organs, and it detects that this blood pressure is very low. It will not initiate a process that will lead to the blood vessels to do what? To constrict. So when they now constrict, that is getting smaller, the pressure will increase. As such, the blood pressure will increase. Take, for example, a water flowing through a hose. Once you tighten it by pressing the exit points, like trying to reduce the lumen of that hose, the pressure the water will be using to move will increase. That's the same thing that happens. The kidney does. It constricts it and the blood pressure increases. But if the blood pressure is high, it dilates it to reduce the pressure through release of hormones, and also primarily achieved by the amount of sodium absorbed and the amount of water retained. You know that sodium have affinity for water. So if the kidney allows a lot of sodium to go out, a lot of water to go out, as such, the pressure, if the pressure is low, the kidney allows more sodium and water to go out, as such, increasing the tension. If the tension is high, it will reduce the amount of sodium that is being inversely. If it is high, the amount of sodium retained is lowered. It will release more sodium and water. It will release more sodium, sorry. But if the pressure is low, it will retain more sodium, so that the oncotic, that's what we call the oncotic pressure, would increase. So this is just a kind of a brief idea of why we say they are basic, they are vital signs. So, but the focus of this section is primarily for us to understand how to carry out those processes. So, vital signs are being carried out for healthy group people, that's healthy individuals, okay? Then psychiatric groups and patients too. And we'll talk about that: temperature, pulse, and respiration, and blood pressure. These are the key vital signs. Although pulse oximetry is also a part of the routinely performed vital signs. And we've looked at when to assess vital signs and all of, on admission to a healthcare facility to obtain a baseline data, when a client presents with symptoms, before going for surgery and after surgery, after administering drugs that affect the cardiovascular and respiratory system, or even the thermoregulation center, you will have to also take the vital signs. So what are the rationale? The rationale to vital sign assessment is to ascertain the health status of the client at first contact, to monitor the health of the patient, to monitor the effectiveness of a therapeutic regimen, to identify emergency conditions requiring immediate referral, to provide baseline information for future assessment, to determine body temperature, pulse rates, blood pressure, respiratory rates, and oxygen blood saturation level. That's for pulse oximetry. To assist in diagnosis, to evaluate patient recovery from illness, to provide for objectivity and research, for adequate care and follow-up. We've looked at temperature and how it usually comes about. There are two types of body temperatures. We have the core body temperature, which is the temperature of the deep organs of the body, and we have the surface body temperature, which is the temperature of the skin, subcutaneous tissues, and fats. These temperatures fluctuate with environmental changes. But the body requires what is called the core temperature for cells and tissues and organs to function optimally. The two important determinants of body temperature are heat production and heat loss, like we said. So you begin to have fever or hypothermia when this coordination between the heat production and heat loss is affected. And we said when we were introducing that heat production is from basal metabolic rates, while heat loss is through radiation, conduction, convection, and evaporation. And when we say heat loss by conduction, it's usually through air around us. As you walk, as you are exposed, you lose heat as the air flows around you. Then also conventional heat loss occurs when there is breeze around. And that of the evaporation is through when you are sweating. You lose heat when you are sweating during a sunny day. Then radiation is through ultraviolet rays as the sun takes the heat away from you. And the temperature is being measured with a device called thermometers. And thermometers are of different types. We have that digital thermometer, we have oral thermometer, we have axillary thermometer, we have rectal thermometer, we have tympanic thermometer. So in practice, we can take temperature at the oral site, that is, taking the temperature from the mouth or the oral cavity. However, this site is not usually recommended when someone has taken something cold or hot, because that will affect the surface temperature. What are the advantages of oral temperature taking? It is easy to assess, and it gives accurate result of the body temperature. What are the disadvantages? Oral method cannot be used for more than one person, especially in cases of infectious disease, because it's exposed to the mucosa of the mouth. Oral method might cause injury to the infant. Then oral method may not be used for patients who have eaten cold or hot food, like we said. Also, this site may not be used for patients with oral diseases, oral gingivitis, dental caries, and acute necrotizing ulcerative gingivitis. And also, this site may not be used for patients with who is unconscious. So the contraindications include somebody being infant, a young child, an unconscious patient, or patient who is undergoing seizure. Rectal sites, that is just use of the bulb of the thermometer to put in the rectum of the anus. Usually, it's being lubricated and then inserted into the rectum through the anus. Most commonly used for infants and young. What are the advantages and the disadvantages? It gives accurate results, and it can be used in an unconscious patient. Disadvantage, it might cause discomfort to patients, and it may also cause trauma to the rectum or anus or its surrounding structures. It cannot be used in diarrhea patients and cannot be used for uncooperative patients too. Contraindications for rectal method: inclined to diarrhea, those who have undergone rectal surgery, and those with rectal disease. The next is ear site. Temperature taking can also take place via the ear, because the tympanic membrane receives blood supply from the same vasculature that supplies the hypothalamus. Thus, tympanic temperature reading reflects core body temperature. There's a special thermometer for it. What are the advantages? Human ear is readily accessible. It's not affected by smoking, drinking, or eating, unlike the oral one, where if you drink or smoke, it can affect the temperature. It can be used for unconscious patients too. Disadvantage, it might cause injury to the ear. It can also cause infection of the outer and middle ear. Auxiliary sites. Auxiliary site is considered the least accurate and least reliable site because several factors can influence the measurement. The auxiliary site is recommended for infants and children, although it's a site of choice anyway. That is the armpit. It has the following advantage. It has easy accessibility. It can be used for unconscious patients. It can be used for anybody with less risk of injury. What are the disadvantages? It is less accurate and can be influenced by factors such as bathing, the friction that the healthcare person uses in cleaning the skin can also affect the result. Factors affecting body temperature, we have age. Age has great influence on body temperature. For instance, newborns usually have unstable temperature because their thermoregulatory center is not well matured at that age. Again, in children, the temperature is slightly higher than adults, particularly as a result of difference in what is known as surface area to body mass ratio. Exercise. During exercise, that is, exercise also affects temperature. During exercise, there is increased energy demand, which increases metabolic rate of substances to supply energy to the muscles that are helping the person to be in exercise. Because metabolism increases body temperature, in that heat is being produced during the process of conversion to release energy. Another factor that affects temperature is stress. It could be mental stress, it could be surgical stress, it could also be physiological stress, such as pregnancy. So stress increases body temperature because stress stimulates sympathetic nervous system and therefore epinephrine release, which increases metabolic rates and heat production with subsequent temperature increase. Another factor is drugs. There's what is known as pharmacokinetics of drugs. That is, has to do with absorption, distribution, metabolism, and elimination. ADME. ADME involves use of energy and release of heat. So the process the drug is passing through the body when it's being absorbed from the stomach or from wherever the route of the drug follows, is being distributed all over the body. Its metabolism and elimination leads to release of heat. As such, the body temperature would increase. Also, some certain drugs have direct influence on the temperature regulating center in the brain, that is the hypothalamus, and therefore can alter the core body temperature. So when you take temperature assessment, you must also consider all of these factors that can actually lead to variation in temperature of the body. Then environment and weather condition. When you are exposed to cold or hot weather, it can affect your body temperature, mostly surface body temperature. Food intake. We don't need to explain much on that because you already know that food will have to undergo metabolic process as such. Heat will have to be produced. Hormones, like hormones of pregnancy or hormones that are released prior to ovulation can increase the body temperature of a woman to up to 1 degree Celsius during ovulation. And this hormone, mostly the progesterone. Also, the thyroid hormone that is responsible for growth and all of that can also increase the body temperature slightly. Then finally, physiologic states. And when we talk about physiologic states, it has to do with either pregnancy or you're undergoing a particular infection. When there's infection in the body, it will trigger inflammatory response. And inflammatory response requires metabolic component. As such, the temperature of the person will increase. So these factors largely influence temperature and also largely influences pulse rate, respiratory rate, and sometimes blood pressure. So these are the factors too you're going to be seeing when we'll be discussing about all of them, all these other vital signs. So when we get there, we will not spend our time actually explaining. Procedure for obtaining temperature And one would ask, what are procedures? Procedures are a series of interrelated sequential steps which must be taken by a healthcare provider to obtain accurate information about the vital signs being measured. So that's what procedures are. There are a series of interrelated sequential steps. You have to create a report, welcome the woman, sit her down, create a report, wash your hands, gather your equipment, clean it, insert it. These are all what procedures, and we will not dwell much on that because we have been expected to have been taught in the practicals. The content of a particular tray for temperature taking has to include thermometer, galley pot for swabs, galley pot for dry swab, a kidney dish as a receiver, a jar of Vaseline in case of rectal site is chosen, pen and patient treatment card, wrist or breast watch. Then procedure, welcome and make patient comfortable. Confirm the patient's identity by asking, by calling name verbally. Mr. Emeka, the person will answer to confirm if that procedure is for that patient. Then explain the purpose. And what is purpose? Why it is necessary, what you intend to do. Then the procedure, how we are going to do it. And also how the patient can participate. You have to explain this. Madam, I'll be using your axilla. Please, I would want you to fold your cloth. Then wash your hand thoroughly with soap and water to avoid cross infection. Select appropriate sites according to patient's age and condition. You already know the sites to be chosen. Check thermometer for functionality. You will have to do that. And check the mercury level before below it, and check the mercury level so that you determine the accurate temperature. You have to make sure that the mercury is inside the bulb before you can take temperature. Clean the axilla if you chose axilla and insert thermometer appropriately. Remove the thermometer after 3 minutes. But ideally, why would give 3 minutes? Because as you're taking temperature, you are likely going to take the pulse and respiration. Each of them are 1 minute. Then explain the findings and manage these patients according to your standing orders. So now let's look at the normal range of values for temperature taking based on different sites. One, the oral site. The normal range of value in centigrade is 36.5 degrees Celsius to 37.5 degrees Celsius. Then for axillary, we have 35.8 degrees Celsius and 37 degrees Celsius. For rectal sites, we have 37 to 38.1 degrees Celsius. Then for tympanic is 36.8 to 37.9 degrees Celsius. So now, any other reading below or above any of this range for particular site, like oral, you already see the range for oral, which is 36.5 to 37.5. And if you have anything below 36.5, it's below the normal. It could be hypothermia. Then anything above 37.5 is considered fever. You understand? For oral. Then for axillary, anything below 35.8 and above 37.0 is considered what? Abnormal. Although a lot of school of thoughts can be considered, but these are the basics. Then a lot of infections can lead to fever, but we're not going to look at that in this section. Now let's go into pulse. Pulse may be defined as a wave of distension and elongation felt on the arterial wall as the blood leaves the left ventricle. Over 90 millimeter mercury of blood into the already filled aorta. So this force of blood entering the aorta from the left ventricle causes stretching, or what is known as distension of the elastic aortic wall. The wall of that aorta first expands and then contracts. And as it does that, a wave is generated, and that wave is called pulse wave. As the wave travels along the entire blood vessel, which you can now feel by tapping at the arteries. And that is known as pulse rate. And you can feel it. And that is what we are feeling. It is that contraction of the already filled aorta that leads to the wave you feel at the pulse. What are we looking at in pulse? We are looking at the rate. Either you call it rate or frequency. That is the number of pulsations you can feel per minute, which reflects the heart rate, how the heart is beating. And like I told you, heart rate is a function of what and what? Intrinsic and extrinsic factor. Intrinsic has to do with the firing of the sinus arterial nodes and the Purkinje fibers. Then extrinsic has to do with autonomic nervous system, both sympathetic and the parasympathetic, which will tell us, which will either control the heart rate. So in pulse assessment, we are trying to look at, is anything affecting the heart? And that's what heart rate is telling us. So we're looking at the rate. Then the rhythm or the regularity, either you say rhythm or the regular. How regular? Is it beating or something like that? So the rate of pulse refers to the regularity with which the pulse wave occurs. There's one common condition known as heart arrhythmia, where the rhythm is not regular, and called the heart arrhythmia. The quality of the pulse, is the pulse very full or fainting? And then the volume of the pulse as you are palpating. These are things you are checking when you are holding the wrist of the patient. Now let's look at sites. Sites one can take pulse. Okay, lastly, we're also taking the condition of the artery. As you are touching that artery, it can either reveal to us if the patient is having arteriosclerosis or any other similar issues, So now these are areas where we can take the pulse of a patient. The first here is seen is known as the temporal, the temporal site. It's called a temporal site. It's called a carotid site for pulse assessment. This is known as the brachial site for pulse assessment. And this is known as the radial site for pulse assessment. This is known as the femoral site for pulse assessment. This is known as the apical heart. This is directly under the heart. Directly to the heart, sorry. Site of pulse assessment. Then popliteal is a popliteal site. Then dorsalis pedis. This is called the dorsalis pedis. And posterior tibia is another site to take for pulse assessment. So these sites are usually used in pulse assessment. So this is how to assess the pulse of a patient using the fingers, the right fingers. And this healthcare worker is assessing the radial artery of the patient. This is how to take a good pulse from a patient. So now let's look at the reasons for pulse assessment. One is to obtain baseline measurement of the heart rate and rhythm. Secondly, to assess response of the heart to cardiac medications. Then to assess the blood volume gas exchange. To assess response of patients to any related therapy or medication. And then to evaluate local blood flow and perfusion of the extremities, such as the hand and leg and all of that. So factors that can affect the pulse rate is one, age, like we said. As age increases, the pulse rate gradually decreases. For example, a newborn pulse or heart rate is usually higher than adult heart rate. One of the reasons is to generate and circulate enough heat around their body to maintain their body temperature and to avoid hypothermia, since their thermoregulatory center is immature, which the heart plays a major role by increasing pumping rates. Another factor is anxiety. Anxiety results to a physiological process that leads to heart rate increase and pulse rate because of release of mediators or catecholamines or stress hormones. Exercise, we've talked about that. Fever leads to pulse rate. Remember, we explained this earlier. Fever conditions increase heart rate and subsequent blood flow to systemic circulation, so as to supply white blood cells to the site of infection and to encourage heat loss via vasodilation as part of the negative feedback mechanism. Fear and pain condition leads to stimulation of sympathetic nervous system and the release of mediators and hormones, which increases heart rate and pulse rate. For example, in fear situation, adrenaline is released in order to prepare the body for fight or flight action. Then food. When you consume caffeinated beverages, they stimulate the sympathetic nervous system and subsequent release of mediators, which acts to increase heart rate. Then we have medications. Certain medications you will take, such as digoxin, that's for treatment of heart disease, inflict the pain using treatment of hypertension, can slow heart rate. Hyperthyroidism, that is overactivity of the thyroid gland, increases heart rate and subsequent pulse rate. In bleeding state, these are factors that can affect pulse. Bleeding. In severe blood loss, the heart rate tends to increase as to compensate the deviation. Because as somebody is losing blood, the body will be like, we're not getting enough oxygen. What is going on? Now, the brain will now stimulate the heart to keep on pumping and pumping to supply enough blood. So why you should be aware of these factors, it would serve to help you in making your clinical judgment. Procedure: create a rapport with patients, explain the purpose and procedure to patient, position the patient in a comfortable position, wash hands using soap and water, hold the patient's wrist using the right hand against the right hand, vice versa, placing the index middle finger over the artery and count the number of pulsations you are feeling for the next 60 seconds. Record your findings and interpret your findings based on age and other factors, then give appropriate advice. What are the normal pulse rates? For a newborn, it's within 70 to 190 beats per minute. Sorry, this is yes, pulse rate 70 to 190 beats per minute. Then infant is 80 to 160 beats per minute. Toddler is 80 to 130 beats per minute. Preschool children is 180 to 120 beats per minute. School age is 75 to 110 beats per minute. Adolescent 60 to 90 beats per minute. Then adult is 60 to 120 beats per minute. Adolescent is 60 to 100 beats per minute. I mean, older adult, 60 to 100 beats per minute. So these are the normal range. Any range below or above this for a particular age group, like newborn, infants, toddler, preschool, school age, adolescent, adults, older adults, is considered abnormal. Now, let's quickly also look at respiration. Respiration is the only vital sign evaluated without the patient's consent because human beings can influence the respiratory rate voluntarily. So respiration, like all known, involves process external and internal respiration. And like I said, external respiration is the process of taking oxygen in and eliminating carbon dioxide from the body, while internal respiration refers to the use of oxygen, the production of carbon dioxide, and exchange between the cells in the tissue and blood in the cell. External respiration involves two processes, inspiration and expiration. The process of inspiration is active with the help of the intercostal and extracostal sternal costal muscles. sorry, the process of inspiration is active. That is, it's being carried out with the help of internal and external intercostal muscles. During inspiration, the ribs, intercostal muscles, diaphragm causes the lung to expand. The pressure in the airways becomes negative and air flows inward. Whereas during expiration or exhalation, which involves passive process, at this point, the muscles are relaxed. You understand? So that the air can go out. Normal breathing is autonomic or automatic and involuntary. So you should know that. Why do we have to do respiratory assessment? To assess respiratory status of patient as a baseline data, to determine respiratory disease or disorders, to evaluate the effect of medication or therapies. Factors affecting respiration, like we said, drugs, age, exercise, emotion, fever, respiratory tract diseases, such as asthma, pneumonia, and bronchitis can increase breath rate because these diseases induce pathophysiology, which reduces the lumen of the bronchial tree, and secretion of excess mucus, which reduces the size and occlude the lumen of the structure, which directly increases respiratory effort. Then COPD, known as chronic obstructive pulmonary diseases, also influence respiratory rate. Then altitude. You know that oxygen content of the air decreases in height. So if as you are climbing mountain, the oxygen decreases. As such, you tend to have increased respiratory rates. Gender also influences respiratory rates. In females, respiratory rate tends to be slightly higher than in males because male morphology have larger lungs than females. So method of assessing respiration is assessed without the consent of the patient. You will have to carry it alongside when you are performing pulse assessments. You take that 1 minute to observe the rise and fall of the chest. Some certain things we are observing when we are taking the assessment include the rate, to know how many breaths, to know how many breaths, how many cycles of the respiration the person is going to have. It might be within the range of 12 to 20 breaths per minute. In adults, when it gets to 20 breaths per minute, it's called tachypnea, abnormally fast breathing rates. But when it is less than 12 breaths per minute, it is called bradypnea. That is abnormally slow respiratory rates. You understand? So therefore, a normal breathing rate should fall within the 12 and at most 20. Or because even at that 20, it's even considered to be tachypnea anyway. So let's say from 12 to 18. Although we're going to find out anyway. Yeah, that's what's called the rhythm and depth. Respiration is evaluated for rhythm and the depth. The normal respiratory rhythm and depth in a healthy person is referred to apnea. And this is being assessed by observing and noting down the use of accessory muscles. So when someone is breathing with, you'll be seeing the person using the accessory muscles to breathe. That is known as dyspnea, and which is a sign of difficulty. We also assess the quality of the respiration, because we know that normal respiration is usually automatic and quiet without effort. So when the person is having labored breathing, something is wrong. Now let's look at normal rates. For a newborn, the breath per minute or cycle per minute is within 30 to 60 cycles per minute. For infants, 30 to 60 per minute. For a toddler, 24 to 40. For a preschool child, 22 to 34. For a school age, 18 to 30. For an adolescent, 12 to 20. For an adult, 12 to 20. For an older adult, 12 to 20. So that's why I say it should be within 12 to 20 cycle per minute. So this is the normal range of what respiratory rate. Now let's look at blood pressure estimation. Blood pressure is the force that the blood exerts against the walls of the blood vessels containing it. That's just it. And this pressure is created when the heart beats. When the heart beats, I'm pushing blood from the ventricle into the aorta and the pulmonary arteries. In the heart, there are two phases of blood flow, the systolic phase and the diastolic phase. All these phases create pressure in the vessel. The difference between the systolic and diastolic pressure is known as pulse pressure. For example, if a systolic pressure of 110 millimeter mercury is recorded and a diastolic pressure of 70 millimeter mercury, it will result to a pulse pressure of about 40 millimeter mercury. The blood pressure is measured using equipment called the blood pressure apparatus. The procedure used in the measurement of blood pressure is called blood pressure estimation. A standard blood pressure tool must be of proper size to minimize errors in blood pressure estimation. The width of the bladder, that is the cuff, should be up to 40% of circumference of the person's limb. The cuff should not be too small. For if it is too small, it will give erroneously high. And if the cuff is too large, it gives erroneously low result. So when carrying out this procedure, the patient should be comfortably seated and the deflated cuff applied with the bladder centered over the brachial artery. It should be high enough on the arm to allow the stethoscope to be placed in the artecubital fossa without touching the cuff. Then the pressure is rapidly increased to at least 30 millimeter mercury higher than that, which can eliminate a palpable radial pulse. Using the stethoscope, you can place it over the brachial artery in the artecubital fossa and deflate slowly, at least 2 millimeter mercury per second. So what he's trying to talk about is that the blood pressure cuff should not be too large or too small for the arm. And secondly, that's what we call the brachial artery that's located at the artecubital fossa of the elbow. So you should be able to palpate it and find this artecubital and this brachial artery and place the bladder that has been inflated on top of that artery and give space where you can place your stethoscope without your stethoscope head touching that cuff. Now let's look at the basis of blood pressure estimation using the BP apparatus. You already know that cardiac cycle, that is the cycle in the heart, consists of a period of relaxation, which we call diastole. And during this period, the heart is filled with blood. Then after this period, the next period that follows is known as the contraction phase of contraction period, and that is known as systole. So when the left ventricle contracts, that ventricular pressure increases rapidly until the valves open. Then, after the valve opens, the pressure in the ventricle decreases much rapidly because blood is immediately flowing out of the ventricle into the aorta. Then, from the aorta to the general body. To the general body in the arteries. So the entry of the blood into the arteries So the entry of the blood into the arteries causes the walls of these arteries to stretch, causing the pressure within these arteries to increase to about 120 millimeter mercury. Remember, this is the pressure that is being received from that left ventricle that pumps the blood out, which means that the pressure in the aorta and the arteries is gotten from that ventricular contraction in a healthy person. And this pressure is assumed to be 120 millimeter mercury. But in disorders of the heart or other influences of drugs, it might increase to 140 and above, or even decrease much lower. So this particular pressure now that leaves the ventricle as the ventricle pumps and is being received by the aorta and other smaller artery is known as the systolic pressure. So in a healthy person, it's expected to be within 110 and 120. The pressure that leaves from the ventricle of the heart as that arteries receive it. So when you now tie a cuff, the pressure is being recorded by that apparatus as systolic pressure. This is the pressure of blood that is leaving from the heart, which invariably tells us the force which the heart is pumping it out. Once the left ventricle stops ejecting blood out, the aortic valve closes. Then that elastic wall of the arteries maintains a high pressure in the artery for a short period, followed by gradual decrease of the aortic pressure as the arteries begin to contract. So as this happens within this short period, which is followed by gradual decrease of the aortic pressure throughout the diastolic phase, because the blood stored in that already distended arteries flows continually out through the peripheral vessels back to the veins. Before that ventricle contracts again to pump blood again to that already filled artery, the aortic pressure have usually dropped to about 80 millimeter mercury, but can be higher in disorders. So what this health explanation trying to let us know is that how the BP apparatus measures that blood pressure is that once the heart pumps from the ventricle, the pressure that's moving from the heart, left ventricle, is what the artery is receiving. And that is what that cuff, as it pushes against that cuff, the cuff records the pressure with which it pushes. Then as that blood stays a little while and move away from the arteries to the veins, the actual pressure in the artery before that blood entered will now be, then the blood pressure cuff will also record it again before another push to continue the cycle. So once you tie the blood pressure cuff on the client's hand and you flex the cuff, it immediately obstructs blood flow in that particular artery where you tie that cuff. Then once you begin to release the pressure in the cuff, the sounds are heard with the pressure being recorded. So the first sound you are hearing as you are releasing it, because the pressure have already accumulated before that cuff, that place you tied that cuff. So immediately you're releasing it, the force it will use to push against that cuff bladder will be recorded by the mercury manometer, because that is the already force that has been built up from the heart. It's just finding its way out to go to the vein. So it will now record it, and that pushes it higher. So once that pressure decreases, the actual pressure in that artery will be recorded, and that will be systolic and diastolic pressures. Reasons for estimation of blood pressure: to monitor blood pressure of acute patients, such as hypertensive patients, pregnant women; to screen for hypertension and hypotension during outpatient and inpatient clinic sections; to obtain baseline measurement of blood pressure of patients; to have a baseline data to compare with subsequent changes that may occur during patient care; to enable the evaluation of patient blood volume, cardiac output, and ventricular system; to monitor patient circulatory conditions during surgical interventions. to monitor the body response to treatment regimens. Factors that affect blood pressure: age, like we said, emotions, smoking, exercise, use of drugs, and diseases. Diseases affecting the blood pressure. Diseases affecting the blood vessels will also affect the blood pressure. You already know that the blood pressure is a function of cardiac output and peripheral resistance. If the arteries become too hardened, that means there will be increasing peripheral resistance. As such, the blood pressure will be high. Then pain and anxiety, you already know, will also lead to increase in blood pressure. Then steps: explain the purpose and procedure to the patient before position the patient. Position the patient in a comfortable position. Check the instrument for functionality. Expose and free the upper arm of the patient from all clothing. Do not estimate blood pressure over open wounds or on arms with lymphodema or oedema. Don't try it. Any patient that has oedema or open wounds in a particular hand, do not estimate blood pressure. Even in patients who undergo mastectomy, that particular arm, do not estimate blood pressure in that arm. Palpate the client's brachial pulse is important. But once you palpate, you cannot feel. Please refer that emergency condition. Wrap the cuff around the exposed arm, giving enough space to place the stethoscope. Test the stethoscope for functionality and place it in the artecubital fossa over the brachial artery using the diaphragm. Tighten the screw and inflate the cuff using your left hand. You now determine when the radial pulse disappears. As you have tied the cuff and you're applying pressure, you also palpate the radial artery. Once the radial artery is no longer pulsating, inflate that cuff a little higher to about 30 millimeter mercury. Then gradually deflate the cuff by releasing the screw. As the pressure is lowered, you would listen to hear the correlative sound, which is heard twice. First and second one, systolic and diastolic. Remove the cuff from the patient and record immediately to avoid forgetting, and send back the equipment. Reassure patient and interpret findings and give adequate follow-up instructions. Manage condition according to national guidelines or your clinical judgment. Factors which might give false result in blood pressure estimation include environmental noise, hearing deficit, where the person cannot hear well, earpiece fitting poorly into the ear canal, stethoscope with too long tubing. When the stethoscope has a long tubing, viewing the meniscus from above eye level, failing to pump cuff up high enough, cuff too wild, arm above heart level, releasing the valve too rapidly. So the above factors, if not controlled, are likely going to give you false low results. Do not talk. For you to avoid these things, do not talk and avoid moving the stethoscope or tubing while listening for the sound. Angle the earpiece forward to fit snugly into your ear canal. Use standard stethoscope with standard tubing length. Place meniscus at eye level. Place the arm of the patient at the level of the heart, generally fourth intercostal space. Other factors that are bound to give falsely high results are when the cuffs are too narrow and wrapped unevenly or loosely. When the arm of the patient is unsupported, some of you will just be hanging the patient's hand. You get a false high result. And when the arm is above the heart level. Normal range of blood pressure according to age. Newborn, 60 to 90 systolic and 20 to 60 millimeter mercury diastolic. Then infants, 74 to 100 millimeter mercury systole and 20 to 70 millimeter mercury diastole. Toddlers, 80 to 1-2 systole and 50 to 80 millimeter mercury diastole. Preschool children, 52 to 110 millimeter mercury and 50 to 78 millimeter mercury diastole. School age, 80 to 120 millimeter mercury systole, 54 to 80 millimeter mercury diastole. Adolescents, 94 to 120 millimeter mercury, 62 to 80 millimeter mercury diastole. Adults, 90 to 120 millimeter mercury, 60 to 80 millimeter mercury diastole. Older adults, 90 to 120 millimeter mercury systole, 60 to 80 millimeter mercury diastole. So this is the normal range. So any range beyond this or above is considered abnormal and should be managed. With this, we've come to the end of the vital signs. Kindly drop your questions in the comment section.